everyone. May is Stroke Awareness Month, and since we're talking a lot about women and moms this week, we're going to focus on women and the risk for stroke. Joining us now is Dr. Miranda Gallus with Bon Secours Neuroscience Center in Suffolk with more information and tips for awareness and prevention. Dr. Gallus, welcome to the Hampton Roads Show.
Thank you for having me.
So first, it's a simple question. Tell us, what is a stroke?
Well, a stroke is a condition in which there is sudden lack of oxygen to an area of the brain, so the brain cells start to die. And it can be caused by an obstruction in the blood flow or the rupture of an artery feeding the brain.
What is that perception you would say where people think men tend to get more strokes versus women? What do you say to that?
Well, in fact, women are killed more often than men. Stroke makes twice as many victims than breast cancer every year. Then stroke is the third leading cause of death in our country for women, affecting more than 400,000 women per year. And every year, more than 55,000 women will die of a stroke as compared to men. I think this is very significant.
Obviously, yeah. And when it comes to women, talk about some of the risk factors that women need to be aware of.
Well, we all know, or we've heard about hypertension, diabetes, high cholesterol, obesity, irregular heartbeat, or atrial fibrillation, and these are risk factors for everyone. Smoking is a major risk factor for everyone, but women need to know that if they have migraine with aura meaning those visual disturbances, blind spots, flashing dots, they will end up being at much higher risk for stroke. So they should stop smoking right away. Birth control pills do increase women's risk of stroke. They need to know if they have high blood pressure because all these risk factors are cumulative. Then the postmenopausal hormone therapy can slightly increase the risk of stroke, and pregnancy. Women with preeclampsia, which is a condition where hypertension and urine with protein is found, increases highly the risk of stroke. So women need to know about all this and get checked beforehand.
What about family history? Does that play a big
Well,
factor?
absolutely. So these are part of the uncontrollable risk factors. We cannot control who we are. Who are with our parents. So family history is a big one. So it's important to know all that.
So, the risk factors: smoking, try to quit or not smoke, and to
absolutely.
stay healthy, and know your blood pressure.
Know your numbers, blood pressure, cholesterol. If you have diabetes, treat it. If you're overweight, lose. But just quit smoking right away. That's something you can do now.
And talk about some of the unique symptoms when it comes to women and strokes.
Right. So we all know, I'm just going to mention those sudden weakness and numbness everybody can get, trouble seeing, vision. These are for everybody. But women may experience also hiccups, nausea, limb and face pain. Stroke very rarely cause pain otherwise. Chest pain, palpitation, shortness of breath, generalized weakness. So non-specific type of symptoms. While everybody knows about the face droop and the sudden speech problems.
So if you're going to see your doctor, maybe for a regular checkup, would it be wise for them to just ask, say, hey, can we double check my blood pressure, or hey, I've been having blind spots, because it could be something more serious and they not even really know it.
Absolutely. So please do that and know your family history. Especially if you have that family history, then that's even more important to ask your doctor. So see your doctor, know your numbers. All women over 75 need to be screened for atrial fibrillation, and we all need to know, where we are.
And there's no way to completely prevent it, but you can definitely do things to not be high risk, I'm sure.
Absolutely, there is a lot that we can do. So this control, the risk factors we can control are, we can do it.
Gotcha.
There is a lot to do.
Some great information. Thank you so much, Dr. Gallus. Bon Secours Neuroscience Institute. The website is bshr.com/neuro. That is NEURO. The phone number is 757-541-1110. Dr. Gallus, thanks so much.
Thank you.